Hello, my name is Molly Norris, and for my research presentation, I am discussing my topic, health disparities in the developmentally disabled community. During this winter, we've been introduced to many populations that have faced disparities regarding access of healthcare, transportation, funding, and education and literacy of populations being able to understand healthcare and what's going on. My husband has been working in the developmentally disabled community for almost 20 years. He's been a facilitator, an independent contractor. He's been a job trainer. He was a case manager for one of the local community center boards, which is called a CCB. And currently we own our own program approved service agency, which is called a PASA. Why we have this is that we've seen drastic changes in funding and how resources are allocated within the field. And one of the CCBs decided to discontinue with other contractors, which means you had to create your PASA with the Department of Disabilities of Colorado in order to maintain your current clientele. So we went through this process and became the PASA. So this gives us, and I became involved in the PASA in 2013. During that time, we have personally witnessed what difficulties individuals face in the DD field when it comes to access to healthcare. Now, by access to healthcare with this population specifically, what I'm referring to is finding quality providers to see them, finding transportation to get to appointments and around appointments, family supports and individual supports for understanding what treatments are and what treatments need to be, education of providers within specialized training of the DD field, and funding within the DD field. So let me start out with a basic definition, and this comes from the Alliance website. All my resources will be listed, are listed in my discussion topics. You guys can refer to those if you would like to see them. The Alliance website says that the American Association of Intellectual Development Disabilities defines developmental disabilities as an umbrella term that includes intellectual disabilities but also includes other disabilities that are apparent during childhood. These are severe chronic disabilities, could be cognitive, physical, or both. So in the DD field, there's terms that you guys have probably heard of before, and those are autism, mental retardation, Down syndrome, cerebral palsy. But please also keep in mind this is referring to cognitive skills as well, which could be a lower IQ, lower social service skills, or social skills, and just not being able to understand what treatments are and what healthcare options are. So in the state of Colorado, we work on a waiver program, and Colorado has 12 medical home and community center boards, which are called HCDBS, that is bigger than that I'll be covering right now. The way that it works is they're normally Medicaid or Social Security funded programs, and these programs are the Medicaid and SSI allocate funding for individuals that normally have to sign up at a very early age. If that individual does not, then that individual may not actually be accessible to these services and be meandering the healthcare field all on their own, which is a totally different issue. What they hired community center boards that actually are regionally located, and those individuals get the allocation of funds into them, and those funds then are, and it's a set amount per individual, per need, and those funds are allocated throughout the whole year as expenditures for all medical services, dental services, support services, and resources for community access and things like that, and that includes transportation. So when you're thinking of that, if you have a set amount of funding and you have to plan out for a whole year, you can't really plan for any unknown costs or costs that could be outside of that realm. So if you break a pair of glasses, families have had difficulties getting that. Also getting services covered for specialty treatments and procedures. And that actually brings up an issue with provider coverage. The providers are there, but they're not always trained and able to assist families the way they need to. So you have to find providers that are willing to work with these individuals and also take Medicaid as a payment method. So that sometimes becomes difficult in the small population that is available for them. So looking at this, what I wanted to find out if these disparities of access to healthcare, transportation, funding, and education type resources is something that's locally, or if it's something that I could find in other resources. The first article that I found that actually kind of showed that this is a common problem is called Health Disparities Among Adults with Developmental Disabilities, Adults with Other Disabilities, and Adults Non-Reporting Disability in North Carolina. This was by Haverkamp, Scanlon, and Roth. And what they did is they looked at individuals that are participating within services like our clients and found what disparities, if any, they had compared to other populations. And what they actually found is that the DD field does have known documented disparities when it's regard to emotional support, transportation, chronic conditions, and access to care. And this again is access, meaning providers being able to accept Medicaid and understand what the quality of care needs to be. And this comes down to that this population is not an easy population to treat. There was an article called Healthcare for Persons with Intellectual and Developmental Disabilities in the Community, and this is by Urban, Hinnon, Merrick, and Morad. And they touched upon how our healthcare system focused on acute medical conditions and not necessarily unrelated chronic conditions, and it's not really equipped to deal with people with DD who have chronic diseases with comorbidities and may not understand what that type of treatment is needed. So, I was able to locate and find resources showing that. So then I wanted to see what could possibly be done and has been done within the field to kind of resources for treatments and solutions for looking at the disparities within the field. And so there has been research done. There's been multiple government type based fundings. One was called Closing the Gap by the Office of the Surgeon General that actually gave a breakdown of what the disparities are and possible solutions. And the article by Irwin et al. Was a really good resource when it comes to this, because they really dove into what some of the problems are and solutions on how to fix them. So the first thing that they actually talked about is when we're looking at medical providers, there needs to be a change in the education process within the providers. We need to create resources for them to actually have specialty training. They need to look for specialized continuing ed within the DD field. And what they actually mentioned is some medical schools are beginning to offer undergraduate curriculum in IDD. They're actually creating fellowships in IDD. And this is actually in Canada and the UK have started this process, and the states is starting to follow that. So if we get providers that are educated in care for this field, then we can actually make sure those individuals receiving care understand what's going on and have the access to care that they need. The other thing that they actually talked about is creating specialty hospitals and facilities for this. And it was kind of neat to see that Colorado Springs actually in 2011 created a center called Developmental Disabilities Health Center. And this is a multidisciplinary clinic that actually specializes only in the developmentally disabled community. They offer, case management, behavioral health, mental health, physical, healthcare and well checks and anything that's going to imagine. And that's actually going to be great because not only is the provider trained, then so are the staff on how to actually help with this care. The last thing that we really need to look at is funding for this field. And the ARC, which is again the Association of Retarded Citizens, has a blog, and I found an interesting article that was talking about funding within healthcare, and it was titled "The Trump Budget and Healthcare Cuts Are Devastating for People with Disabilities, Including the Soo-Young's Family," and it gave videos showing how these would personally affect each family. But the thing to think about right now is right now over $800 billion in Medicaid cuts was already approved by the House of Representatives. They are actually proposing and planning another $610 billion cuts to Medicaid and $72 billion in cuts to Social Security's disparity programs, which is the SI that could fund these individuals. So if we are cutting all this funding for these individuals, not only can they get service paid for, imagine what complications that can actually arise from this. So in conclusion, the IDD community is made up from many individuals that require complex and detailed care. They often do not understand the reasons, the resources and access to health care, or understand the treatment is needed. They require dedicated and trained individuals to work on them on a regular basis. These include medical providers, advocates, case managers, family members, facilitators, and a whole team of individuals to support them. And this is with their daily activities and their healthcare decision making. Even though we've had a lot of advancements in that, we've seen supports for these individuals, we need to still make sure I'm creating a workforce that specializes in needs for the DD field. This includes office staff and providers that can assist the patient's families and facilitators. That's in with understanding why follow-up appointments are needed, understanding what access to care is, understanding that the client may not understand what treatment is, and in working on all these within communication with the whole group as a team. We as a society need to realize that this population is funded by Medicaid and Social Security, and if funding is cut, that all the advancements that have been made, and even though right now we still face current problems, we could just go back years and years, and they could face even more disparities. We need to look at these individuals as individuals that require extra services and that are deserving of healthcare and have the right to healthcare with everyone else, and make sure that they get the best health that can be provided through all funding and through people that actually want to help them. Again, my resources are listed if you guys want to refer to it. I appreciate your time. I hope I gave you some information about why there are disparities in the healthcare field, or in the healthcare with developmentally disabled field, and some solutions about how we could do it. I thank you for your time, and have a great day.